So your patient is saying, do not tilt my chair back. I cannot go back with my chair. And I hear some dentists would say, I will not treat those patients, period. I'm not going to reinvent the wheel. I will tell you exactly what I've done in my 20 years of practice. Again, for credibility, my name is Khaled. I'm a dentist in Queensland, Australia. I've been running my practice for 14 years and I took from 1 chair to 10 chairs. And practice name is Lakeside Dental Spa. You can check it below. So if my patient is saying I cannot take the chair back, that's how I will communicate with my patients. Look, let's try to find a common ground. Especially if you're doing like an upper tooth. Lower teeth you can get away by working with the patient semi-supine or even upright sometimes. But let's say you're gonna do a crown prep on a 2.7 and a 2.6, right? And the patient say, I cannot take my chair back, I cannot go back, I cannot tilt back. So I will ask them, like, explain to me why, what happens. I gag a lot, or I get vertigo, and some patients have vertigo. That's a really valid concern for sure. Then I'll tell them, look, let's work on something today. I will try to take the chair very slowly, as far back as I can go, and we have to reach a position where I can work without having to bend, because I can bend. If I bending like that for an hour, I will hurt my neck, I will hurt my back. I wouldn't be able to see patients probably for a week or two, and it might affect my career long term. I won't be able to practice dentistry for a long time. And also, I'm not going to give you a good treatment. You're going to be very compromised. I'm not going to see things well. So let's find a position where we can both work on, and if it works, if it's great. If we can't get this position today in the consultation appointment, if we can't get this right position where we can work, then I don't think I'll be able to do the treatment for you unless we do it under sedation, like intravenous sedation or general anesthetic. And if you don't have those facilities, you have to refer to someone who can do it safely. So with this, I'm not just telling the patient no, I'm telling them why. Because honestly, I don't want to work for an hour like this. It's not good for my career. I would ruin my career long term. If I can find a common ground where I can work indirectly, maybe I'll bend a little bit, but not like that, then I might do the treatment. And then I will tell the patient, look, but there is another thing we have to agree on. I will probably treat you at the end of the day. So it's going to be the last appointment of the day. That's the only appointments I will be able to provide you. So I can have time, be honest with them. So I can have time after the appointment to stretch, get a massage, get some physio even. I have to look after my neck and my back after seeing you. The more you have the discussion with them, if one of those patients they just don't like to lie back just for the sake of it, they're gonna understand you and be nice to you and start to lie back more. If they have a serious medical conditions, they cannot lie back, like vertigo, for example, then they might consider doing general anesthetic or even intravenous sedation. Whatever it is, if you end up rejecting them and you're honest with them about it, the chance of them getting cranky at you and giving you a 1-star review would be very low compared to just rejecting them completely or doing a half-ass job and compromise in their treatment. Be honest, that's how I explain it to my patients, and 99.9% they are fine with it. And if I can't treat them, luckily I can do intravenous sedation in my practice, then I treat them this way. The 0.1% who will get cranky, probably they are not your best patients to treat, because whatever you do, they're not going to be happy with you. If you're honest and open to them about it and they still don't care about you, I don't think you should treat them. So if you find this information valuable, please make sure you like and share and subscribe to my channel so I can grow it more and provide you with more content. Thank you.